Hello and welcome to the Pre-Chiro podcast. I'm your host, Dr. Ben Glass, and today we're making a professional chiropractor connection with Dr. Erik Korzen. Dr. Erik, can you get us started by just reflecting on where you were at when you decided you wanted to become a chiropractor and what attracted you into this path?
Sure, yeah. I actually started in undergrad thinking I was going to become a physical therapist. And as I started exploring my options towards graduation, realized that physical therapists, at least in the state that I was in at the time, didn't have first access to patients. And so one of the things that drew me to the chiropractic profession was that I would have more autonomy. I would actually be able to do my own treatments and evaluations, et cetera, rather than just following a script that, an MD or DO hands over to you. So that kind of started me on the path. And then ironically enough, one of the chiropractors that I currently work with was my wife's first chiropractor, helped her with headaches immensely. And while we were dating, she was like, "Why don't you go observe him?" And I did. And he worked with athletes and just normal everyday folks and just helped everybody. And that kind of started the process for me. So ended up going to National in Illinois, graduated there in 2013. I had been the anatomy fellow while I was there as well. So just have always had a passion for education too.
Mm-hmm. And what was it that attracted you? Like, how did you decide on the school? Was it the chiropractor that you were working with that pointed you in that direction? And can you kind of walk us through, like, when you decided you wanted to become a chiropractor, how much time went by in between that moment and when you were actually starting school? And just talk a little bit about what that transition was like, maybe some surprises you encountered or challenges you faced.
Sure. Yeah. So I did go to the same school that doc went to. So kind of pointed me towards that direction. One of the things I liked about the school that I went to was the fact that they were very evidence based, scientific based. It just seemed to click with me a little bit better. So I really appreciated that focus. Um, yeah, it was probably about a year and a half between when I decided to explore chiropractic and actually get into the program. Um, as far as like issues or concerns that I had going through that, there really weren't many. I'm from Illinois, so that was kind of an easy transition for me as well geographically. I didn't have to like pick up and move across the country. So geographically, it made a lot of sense. It clicked for me, like I said, with the evidence based focus. So it just seemed to be a good fit all around at the time.
hmm And can you kind of just unpack what you mean when you say evidence-based focus? Can you kind of describe what that means for the prospective student audience to better understand what evidence-based means?
Sure. Yeah. So, um, yeah, for the audience that doesn't know, chiropractic, as much as I love our profession, it is a very polarized profession. So we have two different ends of the spectrum typically when you start talking about the educational process. And there's the camp of more philosophy based on one side, and then the camp of more evidence based on the other. And I like to think that a lot of the high quality clinicians end up falling somewhere in the middle of those two because we recognize the evidence, meaning the science, the research, the support, if you will, for the modalities and the treatments and things that we do. But we also realize that there's a big benefit to what we do that may not be as well supported in research. And that's for a number of factors. Funding, probably one of the biggest ones, but there are there's a ton of anecdotal evidence actually in what we do providing benefit to patients that is not totally supported in a randomized controlled, very controlled study in research. So there's those camps of evidence and philosophy, and the school I went to is a little bit heavier into the evidence base, meaning they focus more on pathology and biochemistry and the basic science part of it that supports the evaluation and treatment.
Got it. And can you kind of just walk us through what you gravitated towards in your own personal journey, like what directions you went in while you were in school or even as you were graduating school, what you were really passionate about, what you were really focused on?
Sure. Yeah. So yeah, as I mentioned, I was the anatomy fellow when I was in chiropractic school. So I ended up going through all of our cadaver-based anatomy programs, and ended up becoming the anatomy fellow, which meant I was running the cadaver lab. I was helping professors set up exams, proctoring exams, tagging things, doing further dissections, doing advanced dissections, all of this really cool anatomy stuff, right? And for some reason that clicked with me. I don't know, like biochemistry and physiology and the stuff that I can't really see was always more difficult for me. But the actual, like, I can palpate, see it, touch it, cut through it. The gross anatomy just made a lot of sense to me. So I ended up taking that anatomy focus I had and kind of moving that into biomechanics. So I love looking at like breaking down movement patterns. I love looking at functional rehab. I started getting into motion palpation pretty heavily, started getting into McKenzie pretty heavily. The anatomy basis that I feel like I had, that foundation that I had, just kind of led me into this more like biomechanical movement sort of science, which is how I practice today.
Can you talk about the specific resources, training programs, certifications, anything, seminars that you went to that were really valuable?
Yeah, honestly, I think one of the most valuable was probably going to some student clubs while I was in school. Those are hugely beneficial. I feel like students, it's a crazy time, right? Going through chiropractic school, there's a lot happening. There's a lot going on. You have tests, you have projects to work on. It's stressful. There's a lot happening. You're typically your butt's in a seat from like 9 to 5 every day, Monday through Friday, right? There's a lot happening. So that lunchtime can be pretty, at least at our school, clubs were typically during lunch or in the evening hours. And obviously, I know those are valuable times, but those are really, really crucial times as well to expand your own skill set and go to some of those clubs, learn from other people. And honestly, just learning basic palpatory things like how many times can you get your hands on different people before actually getting to your clinical phase. So I think going to those student clubs was very beneficial for me. Starting going to motion palpation clubs and functional rehab clubs, and then started getting involved with other organizations on campus too. So I think that is probably the most beneficial. Is just how do we get exposure to some of the things that you're actually going to be doing day to day, rather than just sitting down and studying like biochemistry and trying to pass a test.
Hmm. And can you talk about your transition into the real world, some of the interesting things about like you being a chiropractor now? Like what are your favorite aspects of like what it is that you get to do or what your lifestyle is like? We're trying to build context for the high school or college student to better understand like what are the attractive things about becoming a chiropractor, and then also what are the biggest challenges or adversity that you're also facing of being a chiropractor?
Okay. Yeah, I think one of the most exciting things, honestly, is I love helping people. So every day I get to help people, and that's probably the coolest thing. And whether that is physically like helping them with their pain, or like helping them process some things and helping them realize that there might be other components there that we need to break through, that would help them from an entire life perspective. That's probably the coolest thing that we get to do every day is help people. I get jazzed about it. I love that. So that, and I love educating people too. So anytime I can take a moment to explain why we're doing something, I love to be given that opportunity. So those are probably the two big ones for me: helping people and then educating them.
Mhm.
Um, some of the adversities, honestly, getting out of chiropractic school, I didn't realize that after all of our education and I learned a ton, I felt like I had a ton to offer, that there's some societal barriers as far as what society thinks chiropractors are and how we get some training. Um, so you get out into the real world and all of a sudden it's like, oh, you can crack my back. And it's like, cracking my back, that is like a very small piece of what I do day to day. Not that it's not beneficial, not that I don't love to do that, but I am so much more than just a back cracker, right? So that was probably one of the biggest hurdles for me, was understanding like, okay, what is the general population's idea or perspective of what a chiropractor does, and how do I intelligently incorporate everything else that I can do and offer into what their expectations are, right? And try and meet those expectations.
Mhm.
So that was probably one of the biggest struggles for me. One of the other big struggles too is integrating with other healthcare providers. I love to work with other healthcare providers, and it's awesome when you come across some that are willing to work with you. But it is also difficult. Again, this is that idea of in the chiropractic profession, we just have such polarizing, camps, unfortunately, that other medical professionals don't know the chiropractor that they're going to interact with and what that process is going to be like. So some are extremely hesitant. And there were definitely some barriers there too to integrating with other providers, whether it's orthopedic surgeons or neuro or PTs, whatever.
Mm-hmm.
So that was probably another barrier.
Mm-hmm. I find it interesting. I've heard you mention a couple of times the whole polarization within the profession. And I actually went to University of Western States and then I transferred to Life West. And I was blown away by how vastly different the experiences of the students at those schools were. Just the educational experience is so different. And I think that that perpetuates this polarization. And I think that if I'm being completely honest, this project was created out of that recognition that if we had shared experiences, if we had mutual respect amongst all incoming chiropractic students, that no matter whether you went to National or Life University, you knew that your fellow students that were going to chiropractic school had gone through the same hoops that you went through. They had studied the same things you went through. They weren't that different from you, and they actually had a lot of shared interests, and that you were able to stay connected throughout school. We would completely, I think, minimize this what I would perceive as kind of like imaginary difference between us. Like we don't really have that many differences. Um, yes, there is some stuff with the lexicon and the terminology and the philosophical sort of divergence from like, are you locating vertebral subluxations and adjusting them, or are you manipulating the spine for functional change? Like, that's just in many ways what is keeping the profession from progressing forward as far as like us pooling our resources and leveraging our efforts to like come together and just say, hey, we're all chiropractors. We all need to like actually find a way to find common ground and just focus on what brings us joy as opposed to what divides us. You know what I mean? So that's what my hope is for this project, to reach people before chiropractic school, hear from you who went to National, and also just hear like the authenticity and who you are and the integrity and who you are, and like you're a chiropractor out in the real world. So I'm just curious, like you talk about like how you can help people. Can you kind of just talk about specifically like what somebody's experience is, like how you examine them, how you treat them, like what that process is like?
Sure, yeah. And I totally agree with you, by the way, on the idea of and coming from prior to my current position, I was a professor at National as well. So I came from that background too of teaching and seeing the differences in, like you said, going to one school versus the other. And really, there should be that camaraderie of like, we're all chiros, we're all in this together. And I think that is one of our biggest limitations is this interprofessional, like this infighting that we have, honestly, which is our it's like blocking ourselves from moving forward, right? From progressing. So I totally agree with you on that. I would love to see us come together, find common ground, and actually establish more of like a foundation where we can move forward from. So I would love to see that too. What was your question though? I'm sorry, I kind of got off.
Just walk us through the patient experience at your office, how you observe them, maybe some of the diagnostics you do, some of the ways that you take care of them, and how long you work with people or what your relationship is with people.
Sure. Um, yeah. So I love to connect with people. So that's one of the first things I do. I try to connect with somebody. Um, so my new patient exams are about an hour long, and that includes not just the exam, right? That's the exam, treatment, doing some rehab, etc. So most of my exams include like typical exams, range of motion, orthopedics, functional movements, palpatory, all of those like typical things that you would see. Um, Treatments typically consist of soft tissue work, joint mobilizations, manips, um, different types of rehab exercises, like mobility exercises, stability strengthening based on what the patient needs. I'm a big proponent of helping a patient realize what maybe some of their triggers are for some of their symptoms, and helping them break through that barrier and realize that they can actually take ownership of some of their symptoms and their health, really. And so being able to have that like trigger, that tie-in that a patient gets and actually like locks in, goes, oh, that's right, I always have low back pain when I bend over and pick up my 3-year-old. Okay, well, how can we work on that? Like, obviously, let's get you out of pain, but functionally, what can we do to help train you into that? So let's work on bracing techniques, and let's work on hip hinging movements and all these patterns and things. Um, in the meantime, let's get you out of pain. Let's teach you some really basic, easy things to do at home, and then we'll work on like re-grooving some of those patterns. So that's typically like just a very sort of generic, big picture of how I flow.
Hmm. And I'm just curious, what specifically differentiates you from, like, say, a physical therapist? Just because both of my brother-in-laws are physical therapists, and they would have described their, and I go to a physical therapist for exactly what you described. They do soft tissue, they do some mobilization, they walk me through functional movement patterns, they diagnose my movement imbalances. And then they help give me an at-home sort of empowerment program that I can take care of my own body. I'm just curious, and this is not like supposed to be a loaded question at all. I'm just curious, have you observed other physical therapists that do something similar to you or not? Are you aware that there's a lot of crossover? And if so, does that allow them to refer to you, or allow other professionals to refer to you, knowing that you're doing a great job and providing a great service? Because I do find a ton of value in everything you just said. I'm not saying that at all.
Yeah, no, and honestly, this is where our fields cross significantly with PT. And we have physical therapists actually in the practice that I'm in that we continually cross refer. So yeah, the way I look at it is chiropractors and PTs that are practicing in this physical medicine realm, let's call it, right? Um, we all do similar things, but we do it to a different ratio. So what I mean by that is chiros tend to be more focused on the hands-on work and a little less focused on the active care part, the rehab, the stretching, etc. And then we flip that on its head for physical therapy. Physical therapists tend to be less focused on the hands-on, not that they don't do it, but they're less focused on it, and then they spend more time, more focus and energy on the more complex movements and things like that. So that's how I see us kind of combining on that front. And really, like what we've done in our practice here for the most part, and this isn't every patient, but for the most part with our PTs here, what it ends up happening, let's say a patient comes in with acute pain, they come see a chiro to start with. We hopefully get them out of pain. We get them moving a little bit better. And then if we recognize that there's some movement patterns that may take a little bit longer or may require some more like diligent focused time on that, we refer them to PT. Because in the 15 or 30 minutes or whatever that I spend with an entire patient here, we're not going to be able to retrain an entire movement pattern with that time, right? So then we send them to PT. They can spend an hour doing things once or twice or however many times a week they recommend that. And then the PT can focus a little bit more diligently and heavier into that the movement pattern type process.
Got you. So where's your focus and your passion at these days? You've created this channel called the Chiro Residency. Can you describe what that project entails and where your focus is with that?
Yeah, of course. So as I said, I came from being a professor at National, and the owner of the clinic here in Annapolis, Maryland. We just have some mutual friends. So he called me up one day and was like, "Hey, I have this idea. What are your thoughts?" So I started doing some research on residency programs in the chiropractic profession. And for those of you that don't know, there's really not that many opportunities out there when it comes to residency programs. There are a handful of residency programs that exist at individual schools, chiropractic schools, but they're typically heavily focused in getting you ready to sit for diplomate, which is an advanced sort of certification. Usually these residency programs are in like radiology, rehab, sports med, Those are probably the top three as far as popularity goes. But in our field, we just started to see probably around 2014 or so, the VA system, the health system, started incorporating chiropractic residency programs, and those have begun to now expand across the country. There's now, I believe, 7 sites that are accredited by our accrediting body in the profession, which is awesome. It's a great opportunity, great experience for someone that wants to be in that setting, that wants to work in a hospital-based setting. Not that I want to take away from that, but not all of us want to practice in a hospital-based setting, right? Some of us like I like being in this outpatient physical medicine setting. That's where I fit and I flow. Not that I don't want to work with other providers, because we do, but I don't really want to work in like a hospital inpatient type setting. So with that came the idea of, how do we take a private practice like this that has a physical therapist, that has a pelvic floor PT, that has an acupuncturist, that has a nurse practitioner, that has 4 chiros? How do we take that idea and create a training or residency program around that? So I've been in Annapolis now for about a year, and since coming here have literally just sat down and started developing a residency program. So this is the first private practice to ever seek accreditation for a residency program, which is a pretty cool. It's been a really arduous process, I'll be honest, but it's a really cool experience. And in this process, what we've developed is a 12-month residency program where someone would graduate chiropractic school, come here, get hired as a resident. They would actively treat patients for about 30 hours a week. And then the remainder of that time during the week is for mentorship sessions and observations and scholarly activities and some training, et cetera. So we really try to take this and make it a real residency program. There's an application process, just all of those steps that you would see in other healthcare fields that have residency programs. That's what we're trying to create here. So that is what my passion has been over the past year. And like I said, it's been a pretty, it's been an uphill battle, to say the least. I've learned a ton in this process. But I think as we move forward with this, my passion has always been to progress the profession. And if you follow us on Instagram, literally every post is progress the profession. That's our hashtag. That's what I use for everything, because I really, like we talked about earlier, the polarized sides of the field, I would love to see go away. I would love to see us all on the same level ground. But we need to do some things and create some changes and progress in order to get there. So this is my sort of contribution to how do we progress the profession. This is my piece to that. So
I'm curious if you could expand on what's possible with a residency program that's not possible in, say, an associateship position that somebody takes at an office. What are the opportunities that are created when you have such a structured experience for a new graduate, and what are some outcomes that you're hoping can be achieved with the graduates of the residency?
yeah, and those are both great questions. So one of the things that we were considering when we were looking at the residency program was, you look at an associateship, a typical chiropractic associateship is someone that's a fairly recent grad that comes in and is working underneath a more senior doc that's been there for a while, right? Maybe it's their own practice, maybe it's not. And they take them under their wing, so to speak, and help train them. Unfortunately, a lot of associateship experiences turn out to not be that great. Not that there aren't good ones, but some of them out there are not great. And so what ends up happening is there's all these sort of like promises of, I'm going to train you in this and that and teach you how to do these things. And really what a lot of that comes down to is, how can you build the practice? How can you increase patient volume? How can you do some marketing things, et cetera? And that, although those are some skills that need to be taught, I fully agree with that. I do think that a lot of these new grads are coming out with like the ambition and they're hungry for more of the actual clinical training, rather than just how do I increase my patient volume? Like, that's important. We need to see patients in order to make money. But clinically, these new grads are coming out really, really hungry, going like, I don't know if I feel all that prepared to jump straight into practice. So how do I get some of that hands-on training still while being supported and actually able to practice and like apply those skills, and at the same time having clinicians around me to support me through that process. So obviously I don't know what the future holds. When we look at the chiropractic profession, though, when it comes to these residency programs, what I have found out after all of my like meetings and discussions and connecting with people is that the field of optometry is actually fairly similar to ours. They have optional residency programs. The difference is we're about 40 years behind optometry right now, which means they started about 40 years ago with VA residencies, then they went into schools, then they went into private practice. And private practice residencies in optometry have only been around for about 10 years. So, I mean, when you look back and see the timeline of how they've progressed, it's pretty outstanding, like where we're at and really where we kind of still need to go. And that being said, one of the really awesome things optometry did was, if you want to have certain positions, let's say within larger healthcare organizations and hospital settings and some other groups, you have to be a residency trained clinician. If you want to teach in their schools, you have to be a residency trained clinician. So I would love to see opportunities like that develop in our field through residency programs like this, where, yeah, I can actually say I've been a residency trained chiropractor, and these are the opportunities or benefits that may come from that. Again, I don't know what the future holds, but something like that would be ideal.
Can you reflect on the demographics of who was at the school with you, just so that you can give a flavor of like the types of people that were attracted to these to the program that you were in at the chiropractic college, and then also talk about the characteristics or the interests or the motivations behind the people that are going to be driven to go into a residency program. Obviously, you just described what you think residency trained clinicians will be able to do that they wouldn't be able to do without that. So maybe they're motivated to go teach at an institution. Maybe they're motivated to create research. Maybe they're motivated to work in a hospital setting or even at maybe a school. Can you, because actually, this actually brings up a little tie-in. What I'm hoping to see more of is that this pre-Chiro presence that gets created on college campuses and high schools around the country leads to there being more chiropractors in the health centers at those campuses, because right now there's absolutely no presence of chiropractic within those multidisciplinary setting. It almost is kind of a hospital-like setting. However, we need more presence, and it sounds like you're building that bridge. It's just very fascinating for me to like hear kind of what the qualifications are to work in those types of clinics. And it sounds like that's what you've identified to be a key or crucial component. But if you could just go back to my initial question, which is like, who was at this chiropractic school with you? Who would be in this residency program? Are these older people, younger people? Are these people that are career changers? Are these like college athletes? Are these former scientists? I'm just curious if you could just reflect on some of the students and some of the people.
Yeah, sure. So yeah, when I was in school, and I started chiropractic school back in what, 2008, nine, something like that. So it's been a while. But when I was in school, the demographic at National at the time was a lot of folks like myself who were health science, pre-PT, pre-med, very sort of like sciencey based folks, right? But also at the same time, we had a handful of people that were like, this is my second career choice, that are in their 40s, let's say, rather than the young 20 something straight out of college. So I feel like, and I know not just at the school that I went to, but at a lot of schools, there's a lot of diversity in chiropractic students. Even transitioning from my experience as a student to then being a professor in the same program, we started to see more of a transition of students having less of the sciencey based background and more of just like a broader education experience, right? So there were folks that I had that were students of mine that didn't have a bachelor's degree in biochemistry or pre-med or health science or anything like that, and they may have had a bachelor's degree in communications or something. You know what I mean? Like they had a very broad sort of educational background. Not that they didn't hit all the requirements they needed to, but they just had a different experience. So I would say chiropractic college in and of itself has a pretty diverse demographic when it comes to the student population. Um, but then, I think to go back to your point of looking at like chiropractors on college campuses and stuff like that, in those settings, right now, I feel like the only sort of in that we have in that setting has typically been in the athletic department, right? But even still, it's like under the radar. Like it's not an official chiropractor. We have someone who works in our training room or something like that, who everyone knows is a chiropractor, but it's not like outwardly advertised that we have a chiropractor on staff or something. So I would love to see that change too. I mean, that would be awesome. I would love to see chiros get into ortho offices and do their initial evals and even tell them like this person may or may not be a surgical candidate, like because we have the ability to help make those decisions, or other avenues like that. I'm not sure what that looks like, but different aspects like that would be absolutely awesome to see our field get into. So yeah, that as far as demographics go, that's kind of what I observe both as a student and a professor.
Right on, man. Hey, listen, I really appreciate you just basically just sharing some insights. I think that it's super valuable that we keep providing voices of people that are actively engaged in the profession, that are creating and contributing to, like you say, the progression of our profession, developing infrastructure, and also just developing a better pathway for students to go through, that they can feel as though their options are not limited, their options are very abundant, but also their options are very structured, and there's a supporting sort of energy behind what it is that the profession is trying to move in the direction of. Is like, how can we better support students to become just better at what they do, and clear on who they are, and just more effective in many ways. So anyway, I just really appreciate you taking the time. Do you have any questions for me, or any specific things that have come up from this conversation?
No, this has been awesome, man. I'm glad we can have a conversation. This is some of the things that I've been working on doing, setting up conversations like this. And honestly, it's just so that way, like you said, people know what options are that are out there. Even if you're in high school or an undergrad, and you're considering, chiropractic as a career path, knowing what is coming out and what is innovative and what's happening in the field, rather than just I need to go to chiro school so that way I can get this doctorate degree and like maybe go back to my hometown and work for my chiropractor that my family's been seeing for the past 20 years. Like if that's what you want to do, cool, great, go do that. But if you're also like, man, how do we like push the needle on this a little bit, how do I do something different, like that's the kind of stuff that is really cool to be a part of. And so having conversations like this simply to inform people that this is, in existence or developing, is a cool opportunity. So thank you for having me on.
No doubt, no doubt. What's the timeline on when you're going to be offering your first residency positions, and kind of what's the scale potential with like how you can scale this thing? What's the vision for what's possible with this project that you're working on?
Yeah, so our residency application, our deadline right now is August 1st. So we're actually accepting applications right now. We've been processing applications as they come in. I would like to start someone in the fall. That would be the goal. But obviously, as we like kick off this first cohort, most likely it'll be one resident that we start with, honestly. As far as scaling it, we're probably looking at about 3 residents max that we could have at one time. And mainly that's just because of like our physical space. So that's what that looks like. The future though, hopefully with the residency program, is if someone's a great fit in our clinic and wants to stay in Annapolis, then we may hire them on a full-time clinician and they get to just, transition from being a resident to just full-time practice. Or if someone wants to like go back to their hometown or open up their own clinic or something along those lines, like maybe we can support you in some way and do that. And what's awesome is I just want, if someone does that, that have our absolute blessing, because we know that they're just going to be awesome chiros. They're going to be fantastic clinicians because they went through the residency program. So they're going to be great advocates. They're going to be rock stars in our field. So even if they don't stay internally here, then great, go out into the world and like tell everyone about it, because it's a cool thing. So that's more long term, obviously.
I'm just curious, do you guys use any diagnostic equipment there? Are you doing x-rays? Are you doing any sort of functional diagnostics beyond just like observation and orthopedic and stuff like that?
Yeah, so we don't have any diagnostic imaging in house. We send everything out as far as diagnostics go. We do have a nurse practitioner here that does some of the higher level stuff that she needs. If she needs to, like, she's getting into. She's been doing a lot of hair tissue, like mineral analysis, obviously blood work, and um, saliva testing and that kind of stuff. But that's more like functional medicine, internal med type stuff.
Yeah,
But as far as like
I was more talking about in the world of physical medicine. Like, I don't know how familiar you are with chiropractic biophysics, which is obviously very evidence driven. They've got over 250 papers they've published, and I'm just curious if you're studying any of that, like sort of global spinal motion and positioning, alignment, and I was just curious.
yeah, so yeah, we don't have any of the diagnostics in house. We send everything out for imaging, and I don't believe any of our chiros are specifically trained in chiropractic biophysics.
Okay. Are you familiar with it? I'm just curious.
I am, yeah, yeah,
Yeah.
yeah,
Okay.
yeah.
Yeah, just because like when I think of like alteration of motion segment integrity and looking at angulation and translation and disc height, that usually comes after somebody has been given a spinal x-ray, and then there is an additional supplemental diagnostic that helps identify whether there's excessive motion or not enough motion in the spinal segment in question. So I was just curious, like how specific you guys are getting on the spine, and specifically like how balanced the spine is, how it's moving.
Yeah, I mean, most of what we do is based on movement patterns and functional movement assessments that we do with patients.
Got it. Got it.
Yeah,
Okay. Sweet. Well, thank you so much for sharing. I appreciate it. And if there's anything else we could do to collaborate or connect in the future, by all means.
awesome. Thank you for having me on. I appreciate it, man.
Absolutely.
Take care.
You too.